So one of the things I have found since the moment I walked into this whole conference is that most of the times I have to explain to people what the precautionary principle is. And here I think everybody gets it. I've heard a number of people talk about it, but I will mention it and how we tie that in with our clients' sustainable goals, and also talk a little bit about resiliency. It's also been very exciting to hear other folks talk about resiliency today, and that's the first time it's happened. In most settings. And you've already heard a lot about the LEED rating system. What I was going to present on is a little different, and hopefully will just help be more informative for you. And then I'm going to talk about sustainable opportunities in the design of healthcare facilities, and talk about how our approach is, and then, of course, open it up to some questions. So I think you're all familiar with the precautionary principle. I've heard a number of people mention it, as I said, and talk about it. And so I'm basically our goal is definitely to think about the design of buildings from a health perspective. So it's better to be safe than sorry. And we heard earlier about identifying a green champion for setting up a green team, but it's also really important when you're designing a new building to also have a champion for the sustainable process, the design process. Hopefully maybe more than one, but at least one on the client side, and definitely somebody on the design team as well. Another thing to really look for is to identify what type of sustainable resources you might have in place on your client side. And because you're going to have a number of people on that design team, and some of those folks may not understand sustainability. They might not even know that their organization has some sustainable resources available, and they need to be educated about them. They need to know how that really ties in with who they are. And this is just an example that I'm sharing with you from the U.S. Army. And so when we began working on that project, we tried to identify everything that they had in place so that we could really weave our design decisions in with what our clients' goals were, and what their mission, what their value, and really pay attention to what their values were. As you heard, I've done a lot of work with Kaiser Permanente, and it's very exciting to work with a client that already has an EPP in place, an environmentally preferable purchasing plan in place. And as a part of their EPP, they identify the chemicals of concern that they want to try to avoid in the products that you're going to specify for their project. I'm an interior designer by training. I don't have a big science background, but I'm a materials geek. I thoroughly try to research the materials that go into our buildings, and I try to avoid the chemicals of concern when I can. And so to have a client that already has an EPP in place is really fantastic, because, again, the entire design team and the entire team on that client side isn't going to understand everything that we're working towards. But when you have this in place, it helps to support your overall goals. Resiliency. One of the things that we talk about with our clients now, and which is not something that we used to really focus on even a few years ago, is resiliency. Depending on which part of the country or which part of the world you're on, being resilient and for a healthcare facility to remain standing and to remain viable to support that community after some major something or other has happened, depending on where you are. We have this discussion of, how do you plan to stand standing? What are your goals? And then we look at how we're going to be designing that facility to definitely try to support that, whether it's earthquakes where I'm from or fires. Here you've got hurricanes. There's tornadoes in many parts of the country. It's definitely a part of the equation, and it really ties in with sustainability and supporting the community. So we ask about, how do they plan to continue to operate? What kind, how might the repairs impact their facility? How long, could they stand to be out of operations? An acute care facility is very different than outpatient clinic, for example. So we need to understand those so we can really design to meet that. you heard a lot about the last project, meeting the LEED rating system. And I just want to, before you heard that presentation, how many of you were familiar beforehand with the LEED rating system? At least half. Okay. So you're pretty familiar. I will go through it much quicker. But it's the most recognized rating system in the world, really. And it covers a lot of different categories. There's many different types of rating systems that you can use today that are available for use, I should say, depending on the type of the building. And when the project that was just spoken about was under-designed, LEED for Healthcare wasn't available yet. But there is a LEED for Healthcare available now. And the new version, called LEED version 4, LEED for Healthcare will only be available for acute care facilities and not for outpatient clinics, which is different with the LEED for 2009 edition of it. There's 4 different levels. You can meet certified silver, gold, or platinum. And there's a number of different categories, as you can see here on your left. Sustainable sites, water efficiency, energy and atmosphere, the materials, indoor environmental quality, as well as innovation. Really looking for people to get very creative with the innovation level. Oops, wait a second, went too fast. Another thing that's more recent in the LEED rating system is there are a number of people around the country that were identified to really focus in on the different regions, because in California, what's really important to us, like finding ways to save water, may be very different in other areas of the country where it rains a lot. I mean, you know, those are 2 very different things. Some people might be trying to capture rainwater, you know, and hold on to it. Whereas for us in California, in most areas, it's not going to make a lot of sense to spend a lot of money to capture that rainwater. Not that it wouldn't be something that you wouldn't want to ever do if budget wasn't an issue. But if it is an issue, that's probably not where you're going to put your dollars, because we just don't get a whole lot of rain a good part of the year. And last year, we got very little. For those of you who are not familiar with the LEED rating system, there is a scorecard. It gets updated over the life of the project as you're working on the design of it, and as well as during construction. And this is just what it looks like. And there are a number of requirements in order to basically play the game. You've got to comply with environmental laws. That's never luckily been an issue with any of our clients. It's got to be a complete permanent building. Back in the day when it was in its infancy days, I think some people must have tried to use the LEED rating system on a boat or something, and they decided that it needed to become more restrictive, and really what it was intended to be used for was a building. And you've got to have a site boundary that's identified, minimum floor area requirements. You've got to have at least one person that's going to work in that building. And one time I did run into a challenge when we were working on a transit facility. They had to almost get creative on identifying that they had one FTE. And the client has to be willing to share whole building energy and water usage data. And so that's something, a discussion that you need to have with your client. You need to talk about that. And this just goes into some data on that. So when it comes to developing sustainable strategies, a lot of times you just sit down with a client in the old days and the way we used to work, and you kind of go through that whole scorecard, and really I go through all of the different opportunities that you had. But that can get kind of boring to just go through a list of all of these different strategies. And we like to think a little bit more holistically. And so one of the areas in which we've kind of shifted is that from a design perspective, we're really involved in these buildings as a designer for a pretty short period of time, really, if you look at the life of the building, especially when it comes to healthcare buildings. And so we're tending to look at the project more from, let's start with the operations. Let's really understand how this facility, how you're going to want to operate it for the long term. And then from there, that will really help inform some of the decisions that are probably going to be made on this design. And so one of the areas that we also share with our clients is Practice Greenhouse Healthier Hospital Initiative. And there are a number of challenges, and there's a few of them that truly tie in with design, and those include less waste, safer chemicals, and smarter purchasing. So we might go through all of these areas depending on who the client is and where their interests lie, but we definitely, from an operational perspective and how it ties in with design, the last three are areas that we'll dive into details with them. And because there's enough scientific research out there that shows that exposure to hazardous chemicals definitely are tied to health impacts. And that includes the building products that we specify and how we design buildings. And there's a number of ways that you can also, through the Healthy Hospitals Initiative, think about this. And you heard this morning about green cleaning. We work with our clients on that. The materials that we specify definitely need to be considered from a green cleaning perspective. You've got to make sure that they tie in with a green cleaning protocol, as well as looking at avoiding certain chemicals of concern. In this case, this has to do with more the medical products in the HHI initiative. But from my perspective, I also try to avoid any PVC products, vinyl products, products that have phthalates in them. And then we also work with our clients typically to meet the healthy interiors perspective, which relates to the furniture and medical equipment. And there's a number of chemicals of concern that you need to avoid to meet that initiative. And I don't just leave those chemicals of concern with the furniture and the equipment. I also use those as chemicals of concern to avoid in the finishes as well. And those include the use of halogenated flame retardants, and I expand that to all flame retardants, not just halogenated. For the added urea formaldehyde, vinyl, as I mentioned earlier, and perfluorinated chemicals, or PFCs or PFOAs, which are stain treatments on fabrics typically. And then smarter purchasing. I also work with our clients to understand what type of programs they have in place potentially. You know, they already have a standard in place to purchase furniture equipment, that meets Energy Star, and that tends to be more of the office-related type of furniture, not much in the way of medical furnishings meet Energy Star yet, but that industry is starting to move in that direction. E-peat or Green Seal, as you heard this morning about green cleaning products. And then we also talk with them about this smarter purchasing and how's that going to tie in with what we're specifying for them so that we can help them achieve their goals. Products that meet E-peat, Energy Star to save energy, to also avoid chemicals of concern in the equipment perspective. And then we actually have on board equipment planners, and they will be working with our client from designing of the OR, if there's an OR suite in the facility, and looking at surgical kit reviews. So really looking at from an operational perspective, and then how that's going to tie in with design. And you've already heard some discussion about waste. In order, from an operational perspective, for waste, recycling, and potentially composting to work, we have to design the facility so you, the end user, can have success. If you don't design that facility so that waste and recycling and potentially compost can be actually captured and then taken to the appropriate rooms and then to the loading dock, people aren't going to want to do it. Your environmental services staff are going to just get frustrated, and they're not going to do a very good job of it, if at all. And if you happen to be in my area, where the city of San Francisco has a zero waste policy as of 2020, which is only 6 years away, or you're in Alameda County that has amazing infrastructure in place to take care of recycling and compost, and is also looking to hugely limit waste, you're going to have very unhappy clients in the long run. So from an operational perspective, we want to understand, what's available, what are the goals, where's the what kind of infrastructure do you have in place now, where do you expect to see it in the future, and we work with our clients from a construction waste perspective to meet, a 99% diversion, because we've been able to achieve that, and it's like if you can achieve it once or twice, we're not going to start going back down. So we look at not only the construction and demolition waste, but we also look at the waste and compost possibilities within that facility, as well as looking for working with them to from an overall planning perspective of also how to reduce regulated medical waste in the long run. So our designs need to support that overall. And, I remember one of our clients saying, well, we tried recycling, but we weren't quite so sure about it, but we really want to try it again. But they're like, we just don't really quite know what to do with those soda cans, because they can attract bugs and whatnot. So, we kind of like them just to go into the waste can everywhere, no matter what room you're in. And I thought, well, wait a second here. If you're going to put that soda can that has a residue of soda in it, it's sweet, and it's going to attract flies or some kind of bug in a waste can, how is it going to differ if it goes in a recycled container? I mean, it's going into a container. If your waste container is very similar to the recycle container, but one is just for aluminum cans or other recyclables, what am I missing here? It's going into some container to hold it. So I think if you could make it work in a waste can, you could make it work in a recycle can. So sometimes you really have to listen, and you have to, kind of think, step back and, take a moment and try to help people to understand, you get beyond something that's happened in their past that, has made them think something's not going to work, but that there really are ways of getting around it, and just finding a really respectful way to have that conversation to try to move things forward. So that's just one example. And we need to look at the plans. We need to understand, where do you want the recycle and the waste containers to be in each room? And, who's going to be specifying those? And then somebody at the end of the day, or at some point during the day, is going to come by and collect all of that. And it may be stored in a janitorial closet or a soiled utility room or something like that. But you need to identify that in every single department, again, so they can have success. The environmental services staff have success in collecting it before it all goes down to that loading dock. So we do a thorough check of all of our plans and go through that in great detail with our clients. And then when it comes to the point of selecting the materials for the project, one of the areas that we like to do is to look back at evidence-based design. What research is available in the market today that really can help us to make decisions based on fact-based research. And there's a lot of different attributes that we already have to look towards when it comes to specifying materials. Safety, it's got to be non-toxic. You've got to pay attention to the acoustical concerns about some products, not all, but some of them. Definitely want products that are durable, maintainable, can meet the infection control standards. So we try to understand from an evidence-based design perspective, as well as if the project is pursuing actual LEED certification, how does this all start to dovetail? So on one of our projects, we tried to connect all of those dots. We tried to begin to understand, and I don't expect you guys to read this. I know it's, basically pretty darn small text, unless maybe you're in the front row. But we had a client that was very interested in evidence-based design. They had their own world-class strategies and objectives that we needed to meet. And we're going to pursue LEED for all of those projects. If it wasn't LEED, we would have some sustainable goals for the project. And so we wanted to understand, from an evidence-based design perspective, how did all of the different issues, non-toxic, safety, acoustics, infection control, durability, and on, how did that tie into different LEED credits? So we began to find those synergies, those connections, because that could really help us in the decision-making process, especially when sometimes you run into an issue where, cost may be a concern, but you have these goals for green cleaning at the end of the day. You want a really healthy environment. Well, you can look at what your goals were, what the science tells you, and that can help you to make some decisions. Because you want to think about all of this very holistically. And as I mentioned, there's a lot of criteria we need to look at when we're specifying materials. These are just a few of the areas that we need to really dive in and do some deep research. But it's basically a puzzle, and there's a lot of responsibility. But what has been missing in the equation for years is health. most people have not tied in the decision making about which materials get selected from a health-based perspective. And that's where I really try to bring my area of expertise. There are a lot of chemicals of concern that have been identified, and there are a lot of different lists of them. There's the Living Building Challenge. The Green Guide for Healthcare has a list. The EPA has their list. LEED has a list. It goes on and on and on. And I've looked at all of these long before my good friend Tom Lent actually developed this great Venn diagram. And a lot of these are internationally accepted chemicals of concern that we really truly need to avoid. So I've been working towards trying to avoid them. But anyway, I mean, this just shows you the kind of the complication of this whole area of topic. And so the LEED for Healthcare has a material furniture credit. It's called MR Credit 5. And I worked on the LEED for Healthcare rating system for 7 years. It was the longest baby I ever birthed. Luckily, my 2 real children didn't take that long. But there are definitely some chemicals of concern that have been agreed upon that you'll see in a number of these lists. Urea formaldehyde, heavy metals such as mercury, cadmium, lead, and antimony, hexavalent chromium, which actually I see on these chairs here, most likely. Stain and non-stick treatments, those are typically added to fabrics. Most fabrics don't live alone. They usually have some type of treatment on them, and added antimicrobial treatments. And then at the time we were working with this client, there were a couple of pilot credits we were also working towards achieving for innovation credits, and they include avoiding halogenated flame retardants and phthalates. Those are the plasticizers that go into vinyl products. And but in today's world, though, in LEED version 4, we actually do have some credits that begin to address health in products. And so you've got a building product disclosure and optimization credit. So we're making progress towards actually this being something that I think is really going to help move the market as more and more people move to LEED version 4 and try to actually achieve these credits. Manufacturers are going to want us to be able to achieve that credit. So they're going to be more transparent about what goes into products so we can make decisions based on health. There's also the health product declaration that's now available as of a couple of years ago. I also was involved in working on the development of this. We had almost a year-long pilot program in which a number of 30 manufacturers tested it. And basically what the health product declaration is, or it's also called the HPD, another acronym to add to your vocabulary of acronyms, what it is a resource for you as a designer, you as an end user, to be able to look at what goes into a product and if there are any health hazards associated with that content. Mostly we've just been specifying, products without knowing a whole lot about what goes into them. There are MSDS sheets, but let me tell you, MSDS sheets don't begin to tell you much about what really goes into the products that we have to specify, because if it's proprietary, they're not required to report it. So this is really taking hold in the market, and more manufacturers are filling out HPDs. And so we will now have more information available at hand, which, in some ways is a negative because it adds to the level of work, but I think there's a huge responsibility on all of our parts to make much more informed decisions. And what's really exciting is not only do we have product manufacturers looking at single attributes, such as recycled content, or it's got FSC certified wood or something like that, or it meets good indoor air quality. We have manufacturers now that are being transparent about what goes into their product so that we can, and they are, when they identify chemicals of concern, they're removing them because they have clients that are telling them they will not specify their products if they have chemicals of concern in them. So they are removing them. They're finding safer chemicals to put in them, or just a different formulation, and they're meeting good indoor air quality. So we have product manufacturers that are willing to be much more holistic in the design and the making of their products. So it's a win-win for absolutely all of us. As I mentioned, there is a furniture credit in LEAD for healthcare that gives us the opportunity to push the market from in the furniture perspective as well, in furniture industry. And so there's a few different options to actually meet it. The first two are avoiding, the first option is avoiding at least 4 of the chemicals of concern that are identified on your left, or avoiding 2 of them and making sure that that furniture meets the most stringent indoor air quality requirements available today, or meeting a variety of other LEED credits. And so this is helping to move the market as well to say healthier furniture for our use. And another thing that's even more recent that I'd like to share with you, as of January 1st, 2014, California finally gave us a grace year to meeting what has been known as the California Test Bulletin 117. In my language, we usually just call it TB 117. And it's interesting, these chairs don't have a label on it, but the chairs over there do have a label on it that say they meet TB 117. Typically, you will find it on the bottom of any chair. And thank you. And what that meant is that the cheapest way for a manufacturer to meet it was they basically had flame retardants added to the upholstery foam. And because California is such a big market, this was something developed in California in mid-70s. Since we're such a big market where I'm from, the entire furniture industry decided that they would prefer to only meet California's regulation because they didn't want 2 types of foam to be stored, to be purchased. They'd have to have the foam industry make one foam a different color so they'd know which one they're selecting. And it was just, they figured it was a nightmare. So the de facto standard in all of North America and pretty much the world for residential and commercial furniture has been to meet TB 117. So we now have TB 117 2013 available to us. As of January 1st, 2015, so in just a few months, it will become mandatory in California. But what you need to know is that the manufacturers have a choice in how to meet it. They can continue to meet it with flame retardants in the foam, or they can meet it without, because it's been shown, the TB 117 2013 is a smolder test instead of a flame test. And the older standard, you had to actually test the foam with a flame, but none of us actually sit on foam. We all sit on fabric. And so based on a lot of work that's been done by Arlene Bloom and others, they finally have gotten everybody to realize, we actually sit on fabric, and the fabric is going to be the first part of the furniture, the upholstered piece that's exposed to the fire. And what we need to have is a smolder-resistant fabric, not foam that won't catch fire from a flame, because it's going to, by the time the foam is touched by flame, I mean, it's too late. That furniture is just going to go. So, but the thing is you all have to remember is that you want your furniture to meet TB 117 2013 without flame retardants in it. There's obviously a lot of details, and I'm happy to go over more details with anybody that's interested in learning more, because life is never simple. But this has definitely been shown to be much safer. And the problem with flame retardants in the foam is that it migrates out over the life of the furniture, not just when it gets older, but from the day that foam is made, that flame retardant begins to migrate out of the foam, and there's a lot of health issues associated with it. And they've definitely been able to show there's no significant difference in fire growth between foam with flame retardants formulated to meet TB 117 and untreated foam, and so it's definitely the way we would suggest that you move forward. Kaiser Permanente, in the first week in June, had a press release at CleanMed in Cleveland that they are moving away from furniture with flame retardants in the foam as well. And I've been working with the Center for Environmental Health in Oakland to actually survey the furniture industry and find out who is ready to actually produce furniture without flame retardants in the foam. And all of these manufacturers now have all of their product available without flame retardants in the foam if you choose to order it that way. Remember, you have to ask for it to not have the flame retardants in the foam. It's not standard practice for everyone yet. There are some manufacturers that have some of their product available this year, and they're working towards having all of it available as of next year. And there's more manufacturers that are in the works. And then when it comes to thinking about the overall occupant health, there's a whole nother kind of series of strategies to pay attention to. And we look at evidence-based design. What is available in the market today, science-based, that helps us to really understand how we best need to design facilities so that we can improve alertness. I mean, one of the reasons that errors get made is people can get tired. And one of the ways that people get tired is just by not having access to daylight. Just by having these windows partly open in here, after a long day of listening to people like me, it helps you to stay a little bit more alert. If we had all these shades down or there just weren't windows available, you can get so much more tired. So the staff in a medical facility can make more errors. So we try to design buildings to keep people more alert because we know it's going to help reduce medical errors. It's going to improve their performance. It reduces stress and fatigue. To have that opportunity to see some leaves moving on that tree right outside that window, even if you just look there for a few seconds, it can kind of bring down some stress. Just seeing part of the natural world, understanding what's going on. Is it raining? Is it sunny out? Is it cloudy? It can improve your mood. It helps modulate your circadian rhythms. It can improve recruitment and retention, and we heard that that's a big issue, and we all know that's a big issue in the medical industry. It can also improve patient outcomes. It can help alleviate or reduce pain by having windows and access to daylight and views of the world, and not just a view of a brick wall with the building adjacent to you. That's not too exciting, but actually having a view of nature. It can help reduce medications, which can reduce costs. It can reduce depression and agitation. Like, I was thrilled when my dad chose, when he moved to a building for elderly, he chose a building that had eastern light. So he gets morning light in the morning. My dad has suffered from depression for years, and I thought, yes, Dad, you chose the right apartment. You're in Minnesota where, got a lot of gray days part of the year, but, out of all those places you could have chosen that were available, you chose the one that gets morning light, which has been shown to reduce depression and agitation in the elderly. So I'm like, that was a fabulous decision. Well, healthcare facilities can be designed with that same premise in mind. It can reduce lengths of stay by having daylight, and it can improve your sleep. So when we're designing facilities, we look for those opportunities to try to get daylight in and be as creative as we possibly can. There's many different ways to go about doing it. Many of the buildings that exist in the U.S., especially acute care facilities, but even some clinics, are just these huge, big, giant boxes. And think about how many rooms exist in there that have no access to daylight, no view, no nothing. And people work long, hard hours in there. But there's opportunities many times, not always, which I'm sad to say, but there's many opportunities to really look at designing a building different than just a big, giant block, and giving a lot more people and patients, staff, the family, access to daylight and hopefully some nice views in a garden setting here and there. The finishes really can make a difference as well at really kind of celebrating that daylight's coming in. You've got to be careful, when you have dark finishes and how that can affect things. There's different strategies of using light shelves and redirecting films and many different opportunities today to try to bring in daylight as much as you can. Even, this conference room over here, it's not on an outside wall, but it's got a lot of glass. And the adjacent conference rooms have glass. So even though if they were in that room, in many settings, it might just be all walls and they would have no access, but with all the glass, you can even get borrowed light and borrowed views. And there's value to that as well. So we look for those opportunities, daylight and views. Acoustics, that's a huge thing. The reason, do you know what the main reason is why people get so exhausted flying? It's the noise. The noise wears you down. It wears you out. Noise can lead to errors in a medical facility. The staff just get tired. So obviously, if you're a patient, you can't sleep as well. You can't rest as well. You don't heal as quickly when it's a really noisy environment. You know, after I had my kids, I left after 12 hours. They're like, oh no, you should stay longer. I'm like, no, I shouldn't. It's gonna be a whole lot better at home. My husband's gonna do a great job of taking care of me. And luckily I was basically a healthy woman. So, you know, who really would wanna stay in a hospital any longer than you had to? But the medical staff, they're working there day in and day out. And so we really try to pay attention to designing these facilities to take acoustics into consideration and figuring out ways to bring down those noise levels. And you have to think about it from an interior perspective. You've got to think about it from an exterior perspective. You know, do you have a landing pad for a helicopter? I mean, you know, are you near a freeway? Are you near, in our case, we've got a client that's next to a freeway, next to a BART train, and a very busy road. And they have a helicopter landing pad, you know, on the site. I mean, they're getting hit on all three sides because it's basically a triangular piece of property. And so, you know, then you need to think about the glass you're using and the exterior of that building and many other strategies to pay attention to the acoustics. Positive distractions. I mean, we have amazing positive distractions in this space that we're in this building. Everybody I've heard has been talking about the artwork here. I don't know if anybody of you have missed it. If you have missed it, just look as you're walking down a hallway. I mean, that is amazing. And to have different types of positive distractions in healthcare facilities can also really help people out. And, you know, there's many different opportunities to look in terms of doing that, from small pieces of artwork to, you know, really large graphics to interesting programs that are shown on a flat screen. Maybe they're, you know, different images of nature or whatever. And giving people some control in their life. As a patient, you don't get a lot of control if you're in an acute care facility. If you're in, you know, maybe you have a tad bit more control when you're just going to a clinic. But usually as a patient, you don't get a lot of control. So you look at those opportunities to try to give them some control where it can happen, because it just makes a huge difference that, you know, you get at least a little bit of a choice. As a staff member in a healthcare facility, it makes a difference too. Being able to control the light. We all, you know, even us, those of us with blue eyes, see light and experience light a little differently than our fellow people that have brown eyes. I mean, so we have choices in maybe the light levels as we age, as I happen to be doing. I don't know about the rest of you, but, you know, I need a little bit more light to see. So, you know, so if you give people some control, it just changes the whole outlook. And you end up feeling a little bit more positive about that environment. So we look for those opportunities. And we looked at innovation as well. There's a lot of different ways to be innovative. And the city of New York had a group of people that developed this physical activity concept. I mean, what a concept. Have a stair where it can be visibly, easily seen, so people will want to take that stair rather than the elevator. Maybe you have a little notice at the elevator that says, do you know how many calories you could, you know, carve off today's meal that you ate if you use that stair? How much energy, you know, you're saving? How much you've reduced your carbon footprint? So there's, you know, lots of creative ways that you can actually go about incorporating more physical activity in someone's life if they choose to. Some people may not want to, may not be able to, but a lot of people are looking for that opportunity. And so you can actually get an innovation credit if you're pursuing LEED, or it's just a great concept overall to get your design team and your team that's working with the designers to kind of rethink how they're designing those facilities. And, you know, from, you know, the site, thinking about maybe having some kind of exercise site, and you know, you've got a little path walking around your campus, and it just has a few added signs to tell you how far you've walked. And people just really enjoy that kind of thing. So there's a number of different ways to achieve this credit if you're actually pursuing it as a LEED project. And we've got some projects that are teams that are really excited about it and are actually able to meet it. This morning, you heard about green cleaning. That's something we work with our clients all the time on. we work with our clients, and you're going to hear about integrated pest management in a little while. Well, we've got clients, we've worked on the development of that. The city and county of San Francisco have great resources. We've worked with our VA clients, and they've adopted these as well. In fact, one of the clients I was working with on the integrated pest management, he said, well, I used to work at Yosemite, and we developed an integrated pest management at Yosemite. And I'm like, yes, so wonderful to work with somebody that already gets it, already really embraces it, and it was just, fabulous. And they're totally open to sharing these policies that they've developed with anybody else, and which makes it easier for the rest of our clients that we work with. Development of sustainable purchasing plans. If you have questions on that, Cecilia can lead you all kinds of great resources on that. And then there's a number of credits within the whole family of LEED rating systems, if it happens to be a LEED project. And you can look for ways of really expanding the mandates for the particular credit and achieving, a much higher level. Like with one of our clients, it was easy because, we told the client, the contractor, that they needed to meet our construction waste diversion plan, and we live in an amazing area in the Bay Area, in San Francisco Bay Area, where we have an incredible waste diversion platform just available, and we're like, 75%, that's 2 points in a LEED rating system. Well, we wanted to pursue 95% or better, so they got 99%, and so that's an example of just exemplary performance. And you can also find other credits to pursue as well. So that's it for me, except for a Q&A period. So I'm open to any questions you might have, and thank you. Yes.
How receptive have you seen the medical furnishings industry to be on board with the new healthcare credit? All the requirements for that for furniture and furnishings, because it's very different than the LEED CI, like
Right.
Guard. And have you seen most of the major manufacturers, like, are they on board and can they meet it, or are they still working on it?
Well, that's a really good question. So what Michael's asking is, how does the LEED for healthcare furniture credit is very different than the LEED for commercial interiors furniture credit. And I have used the LEED for healthcare furniture credit and I have sent out questionnaires to probably 400 furniture manufacturers and fabric manufacturers to find out, who can meet, who's got fabric and furniture available without the chemicals of concern. And this is what I've learned. And I did this a few years ago, but I don't think that the industry's moved that quickly, that fast. So I think this is still pretty accurate. The biggest manufacturers, as you can imagine, typically have more of a budget to hire on employees that can focus on chemicals of concern and other sustainable qualities that they would like their furniture to have. Financially, they're in a better position. Some of the small mid-range companies have some staff as well, and you'll find them to be somewhat knowledgeable. I'm not going to say that every really large manufacturer is really transparent or really super helpful in giving you information, because I can think of one that was not. But that person retired, and I don't know the new person yet very well. And I tend to know these people pretty well. I dog them with questions all the time. And some of the smaller companies, they just don't have the budget. Some do have a bit of it and are somewhat knowledgeable. Some of them don't have a whole lot of knowledge at all. One very small company had an opportunity to bid on a huge project for the U.S. Army, 6 buildings and a whole replacement campus. And they just said, what do we need to do? And they hadn't done anything yet. They hired 3, I don't know if they actually physically hired these 3 people to work for them, but they got 3 people on board to start doing the work. And within 6 months, they had a lot of information for me. And I mean, it's amazing. You always wonder, well, what can one person do? What can one question do? That was one question from me. I mean, I do work for a large company. it was a large project. But, I mean, they didn't have to do anything. I mean, that company now has more information than they ever had, you know, the day before I asked that question. So, I mean, part of the reason why I do what I do and talk to people and even tell them about this is because just by you asking questions, we move the market. We get people to change what they're doing. And so I think there's a lot of product available that does avoid the chemicals of concern. Sometimes what you do need to do, though, is if you work for an organization that has older products that the company's been making for years, like if you were if you had standards with Herman Miller or Steelcase, for instance. Herman Miller is a good example because their oldest furniture system product does have chemicals of concern that they cannot remove yet. Not all of them. They're working on it, but if you order one of their newer products, piece of cake, because it's been designed to avoid chemicals of concern. Whereas the older products, it was just designed the way things were designed, and nobody was paying attention. And now they've got to put a lot of money towards, trying to change things out. And they could probably do it if they had somebody who's willing to spend a lot more money on that product. But why? I mean, just move to a different, newer product, and most likely you'll have a lot more success. Yes?
Let's talk about the HPD
Yes.
collaborative.
Yeah.
I thought I heard you saying that there were either sheets or some type of tool for the end users to see what health impact the products may have.
Yes.
Where would people be able to find that?
So the question was, where would we be able to find health product declarations or the HPDs? It depends on the product. It's going to be a number of pages long that identifies the content of the product and any health hazards associated with that content. You can find them in a number of places. Some of the manufacturers will have them on their websites, or you could ask them to provide it with you. You can also find many of them, not all of them, but many of them on the Green Wizard site for free. You can find them most likely, I haven't looked lately, I think on Eco Scorecard. And if you give me your card, I will double check and make sure I'll go back and check the other areas where you could go find them. And they're free of charge. And the manufacturers can fill these out free of charge. Of course, it costs them money in terms of, the time and research time that goes into actually filling it out and the person's salary, but they actually get it to use it free from the HPD site. Yeah. I thought I saw maybe another hand going up. Nope. All right. Well, thank you, everybody.